everyone, and welcome to my video. So today we're going to be talking about two things today. So we're going to be talking about the ambulance just in general and how to perform CPR. So if you just follow me, I'll just get to it. So this is the entrance into the ambulance base. So we'll go in, and to your left there's a car. So this is the ambulance. Come on in. So here are some pillows, some oxygen, some blankets, and here's our trauma kit. And to the right of me, there's some towels, some toilet paper, some gauze over here. And you have first aid kit, you have some gloves if you need them, and some teddy bears if it's optional, if the kids need it, and our defibrillator, and our stretcher. When performing CPR, you want to make sure that the environment around you is safe for you to do so. So right now we're in an ambulance, so we're already in a safe environment, but if you're out on the street or if you're in a house, you want to make sure that the environment around you is just safe in general. Before you start your CPR, you want to make sure that the person you're performing on is conscious or unconscious. If the person appears to be unconscious, you want to clap or make some sort of loud noise on his or her shoulder and ask loudly if they are okay. If the person does not respond, make sure you call 911 and then start to begin your CPR. If you're in a situation where you are by yourself and you have access to a phone, call 911 before you start performing your CPR. Unless you think the person has become unresponsive because of suffocation, such as if you were to drown, then start CPR for 1 minute and then call 911. Also, if there is an AED, like a defibrillator, nearby or in your area of range, deliver one shock when instructed. First, we're going to go through how you actually perform CPR. First, you want to make sure that the person is on his or her back and that they are on a flat surface. Make sure you are kneeled down to the person's neck or shoulder. Once you are kneeled, you want to place one hand over the center of the person's chest, right between the nipples. If you have trouble finding where the center is, look for the nipples and go above and go where both hands meet. Using your upper body weight, push straight down on the chest at least 2 inches deep. Push at a rate of 100 to 120 compressions per minute. Once you are doing your compressions, you want to do 30 compressions and 2 breaths. Next, we want to breathe for the person. If you feel comfortable, or if you have a mouthpiece, using the head tilt chin lift method. You want to lift the head by holding the forehead, lift the chin, and then begin to start mouth to mouth. Get ready to give 2 rescue breaths and 30 chest compressions after you are done your 2 breaths. And so on. This is considered to be one full cycle. Hopefully EMS has finally arrived and you can now take a break. Now we're going to talk about how to perform CPR on a child. When doing CPR on a child, you want to use the same CPR methods as using before as in an adult. Using your 2 hands, or if the child is small, using one will be fine. Press firmly on the child and perform the same cycles as you were doing before. If you are alone while performing on a child, take 2 minutes and perform CPR, then call 911 or before using an AED. If there is still no response after 5 cycles, you are entitled to use the AED if available and apply it as it says. Use the pediatric pad if they are available, but if they are not, then it is okay to use the adult pads. Make sure you do not use the AED for children who are under the age of 1. Send one shock out, then begin your compressions again. And last but not least, I'm going to teach you how to do CPR on a baby. But in this case, we're just going to do a stuffed animal because we don't have a baby nearby or a baby dummy like we had an adult. Doing CPR on a baby is a little different than doing it on a child or even an adult. You want to make sure that your environment is clean just like you would as an adult or a child. You want to lay them on their back and stroke them a few times and maybe tap their foot to see if they have a reaction or anything. If you don't know why the baby isn't breathing, start performing CPR. You want to find the center of the chest by placing 2 fingers in the middle. And once you're done, you want to gently press down on the chest about 1.5 inches deep. Counting out loud helps out for some people too, but start pumping at a fast rhythm. Still pump at a rate of 100 to 120 compressions per minute, but no longer than 10 seconds. No more than 10 seconds, place your ear to the baby's mouth and check for breathing. You also want to look for rising in the chest or breath sounds at all. Now we want to breathe for the baby. What we want to do is cover the baby's mouth and its nose with your mouth. Get ready to do 2 rescue breaths and gently blow 2 puffs of air into the baby's mouth. Wait a couple seconds to see if there were any changes. If the baby's chest doesn't rise, continue to do your compressions. Now hopefully EMS has arrived and you can now release your stress from the baby. CPR is a really hard thing to do, even if it's on an adult, a child, or even a baby. CPR, if performed in the first few minutes of a cardiac arrest, can double or triple a person's chance of survival.